Hello guys, in this video we will learn about the Chiari malformation. So what is Chiari malformation? And the most important structures involved in the Chiari malformations are. So Chiari malformation is the group of structural abnormality where hindbrain structure, that is this is the hindbrain structures, herniate downwards through the foramen magnum causing neurological symptoms. So what are the structures involved are cerebellar tonsil, vermis, and brainstem. So these three structures involved in the Chiari malformations, and this will lead to the compression of neural structures at the foramen magnum and leading to the disruption of CSF flow, and this will produce the symptoms. Before going to the Chiari malformation, let's know about the normal level of the cerebellar tonsil in relation to the foramen magnum. For this sagittal MRI, brain is used. So in this image we can see this is the representative image showing the sagittal image of posterior fossa. So this blue line denotes the foramen magnum, anteriorly called Bayesian, that is the tip of clivus, whereas the posterior is opisthian. This is the lower end of the occipital bone or margin of the posterior margin of the foramen magnum. So this is the line denoting the foramen magnum. If cerebellar tonsil is above this line, it is called normal, and if it is below but less than 3 mm, then it is called the low lying tonsils. And if it is 3 to 5 mm, then it is called indeterminate, and if it is more than 5 mm, then it is called the Chiari malformation. So this is the relation of cerebellar tonsil with the foramen magnum. Pathophysiology of Chiari malformation is the mismatch between the size of the posterior fossa and its content. We can see here, this is the posterior fossa, these are the cerebellum and brainstem are the main structure of posterior fossa. What happens? What is the key mechanism? This is the posterior fossa is small in size. We can see here, posterior fossa is small in size, leading to the overcrowding of posterior fossa structure. Then downward displacement of cerebellum, we can see here, this is denoted by this white arrow, and this will lead to the obstruction of CSF flow at foramen magnum. So these three mechanisms will cause the neurological symptoms, and then we can see here, this will lead to the increase in intracranial pressure. This will cause the hydrocephalus and also the formation of syringomyelia. MRI is the gold standard for the diagnosis of Chiari malformation, and it is diagnosed in mostly sagittal section. Here we can see the sagittal section. This is the sagittal section MRI showing the descent of the cerebellar tonsil along with the syrinx. Classification and radiological findings of the each type of Chiari malformation. So first one is the type 1. It is the most common type, and what we see here in this, we can see that the inferior displacement of the cerebellar tonsil more than 5 mm. As I said that the more than 5 mm is diagnosed as the type 1 Chiari malformation. We can see here in the circle. Another one is the normal brain stem position. So we can see here the brain stem position is normal, and cerebellar tonsil is herniated below the foramen magnum, and there is a very important association, that is the syringomyelia. Here we can see that this is the syringomyelia, CSF signal intensity within the spinal cord. So this is the syringomyelia. This is the very important association with the type 1 Chiari malformation. Type 2 Arnold Chiari malformation. It is the most severe type, and it is almost always seen in children. Structures herniated is the cerebellar vermis, tonsils, and brainstem. As we can see here, posterior fossa is small, leading to the herniation of cerebellar vermis along with the cerebellar tonsils and also downward descent of the brainstem. And it is associated with the myelomeningocele, that is the defect in the spinal canal leading to the herniation of meninges along with the CSF and the brain tissue or spinal cord tissue. Now this is the zoom image showing the a small posterior fossa, herniation of the cerebellar vermis along with the tonsil and also downward descent of the brainstem. So this is about the type 2 Chiari malformation, and in this patients often have the hydrocephalus and require early intervention. Type 2 Chiari malformation can be diagnosed antenatally by the ultrasound. So what we see in fetal life or in antenatal ultrasound, that is the banana sign and lemon sign. What is the banana sign? As we can see that this is the banana sign, the curved cerebellum wrapped around the brainstem. So we can see here this is the cerebellum wrapped around the brainstem, giving a appearance of the banana. So this is called the banana sign. Another one is the lemon sign, that is the scalloping of frontal bones. So we can see here this is the scalloping of frontal bone. So this will form the appearance of lemon. So this is called the lemon sign. So these two signs can help in the diagnosis of the Chiari 2 malformation antenatally, and it can be associated with the hydrocephalus and the myelomeningocele. So myelomeningocele can also be diagnosed antenatally, and hydrocephalus can also be diagnosed in intrauterine life. So this can be seen in the antenatal ultrasound. Type 3 Chiari malformation. So it is a rare condition but much severe form. So what is structure involved in this and what could be the pathology? So there is a occipital or high cervical encephalocele which contains the cerebellum or brainstem. We can see here this is a large encephalocele in the occipital region through which cerebellum is herniated into the this encephalocele. So its prognosis is poor. So it is the most severe form. In type 4 Chiari malformation, there is a cerebellar hypoplasia without herniation of brain tissue in the spinal canal or forming the encephalocele. But it is a very or extremely rare condition. So we can see in this image there is a hypoplasia of cerebellum and also associated hydrocephalus and small size of posterior fossa. Now the examples along with the rapid revision. So if cerebellar tonsil herniated more than 5 mm below the foramen magnum, it is the Chiari 1 malformation. And if you see Chiari 1 malformation, always screen for the syringomyelia. So spine should be look for the syringomyelia, and then the for Chiari 2 malformation, think of the myelomeningocele and banana sign of cerebellum in the antenatal period, and the MRI sagittal view is the key for the diagnosis of the Chiari malformation. If you found this helpful, don't forget to like, share and subscribe for more high-yield radiology contents. Thank you for watching.